Today, let's talk about 5 reasons why physical therapy might not have worked for you. So if this sounds familiar, going to your physical therapist several times per week, you go in, maybe they have multiple patients at the same time, they don't give you a lot of one-on-one attention, they basically give you cookie cutter core stability and hip stretches, and that's it for 8 weeks, 3 times a week. And they give you the same thing that everybody else with back pain and sciatica has, same exact playbook, and they're distracted with other patients. They just give you a piece of paper handout and you're supposed to go home and do those things on your own. There's no real accountability. Sometimes you're not even actually working with the doctor. You're working with one of the assistants or an intern. If that sounds familiar and you're wondering why physical therapy hasn't worked for you, well, I think that, that alone might clear things up. But let's get into depth. Let's talk about some reasons why it doesn't work for some people, when it does work, when it's effective, and what we need to do instead of the typical physical therapy model. And I want to be really clear. This is not at all saying that physical therapy is bad. Physical therapy should be the number one treatment for low back pain and sciatica. It's just that the model and what insurance pays for and dictates essentially care leads to a model that doesn't work because the model is no longer based on actual current evidence-based practice. It's based on outdated narratives and dogma, especially a fear-based core stability dogma. So let's dig into it. Let's first talk about when it works. Now, physical therapy obviously has worked for many people, and you can find good physical therapists in many different places. But unfortunately, by the time people get to me, they've already done multiple rounds of physical therapy and not had a good experience. So I just want to put a note here that says that physical therapy can be very effective, especially when people have acute flare-ups, they're in severe pain, and they just need to get out of that acute flare-up. Because we know that most back pain will resolve on its own, even if you do no treatment. So having some guidance with the first flare-up, if you've never had a history of back pain, if you're not dealing with chronic pain, you just have a random flare-up out of nowhere, it's probably going to go away on its own. So having a little bit of guidance on how to get back into activity can be helpful. So, of course, there are cases when physical therapy works. However, if you are doing multiple rounds of physical therapy and it continues to not work, and they continue to give you the exact same cookie cutter exercises, they're just giving you glute squeeze or glute bridges and clamshells and bird dogs and dead bugs and core stability and telling you not to bend your spine, and they're just doing the same thing over and over, well, of course it's not going to work. So the 5 reasons why physical therapy doesn't work for many people is, number 1, because it's too cookie cutter. You're getting the same stuff that everybody else with back pain is getting. Number 2, they're either giving you exercises that are too easy, they're babying you, or too hard, they're skipping steps, and it's not personalized. They're not actually going at an appropriate pace for you and helping you modify. Number 3, because you don't have a support system between sessions. We'll talk more about that. Number 4, because it is fear-based. Don't bend your spine. If you bend your spine, terrible things are going to happen to your discs. They're using outdated, non-evidence-based, widely debunked methodologies. That is number 4. Number 5 is they are not addressing lifestyle factors like stress, anxiety, depression, sleep, and nutrition. So those are the 5 reasons. Let's dig into each one. Number 1, cookie cutter advice. So again, if you're getting core stability, core stability, core stability, core stability. There are a lot of programs out there for back pain and sciatica, especially online, that literally all they do is core stability. Now, at best, core stability programs can be helpful for people who are in severe flare-ups to help them to get back to normal life a little bit quicker because they're using spine-sparing strategies that can be helpful short-term if you're in severe, severe pain. Worst case, and this is what happens most of the time, is that the people get scared into thinking they have to brace their core all the time. They can never bend their spine, that bending is bad, flexion is bad for the spine, terrible things are going to happen to the discs. And so they get trapped in this core stability rabbit hole, and then they become excessively bracing, tight, overprotective. They stop exercising as much, they stop moving their spine, and that leads to more chronic pain. So that core stability rabbit hole can be helpful short term, very unhelpful and possibly harmful long term because it leads to deconditioning, fear, and atrophy and overprotective muscle guarding. Okay. So cookie cutter exercises, not super helpful. The next reason is that it's too easy or too hard. Okay. The main reason we spend so much time focusing on alignment and core stability and your piriformis muscle, your tight psoas, your transversus abdominis, your sciatic nerve, all these magic exercises that are supposed to correct your alignment and imbalances. And we're completely missing the most important aspect of exercise-based rehab, which is that we need to not do too much too fast, because if you do, you're going to get hurt. And if you, and then not do too little for too long, because if you do, you're going to atrophy, you're going to get weaker over time. And then it's easier to hurt yourself doing simple daily activities because of the deconditioning, because your body is weak. So don't do too much too fast. Don't do too little for too long. That is the single most important thing that we have to get right. And if your PT gives you exercises that skip steps, obviously you're going to tweak it. But likewise, if you do things that are too easy, you're going to tweak it as well. And I'll add to this that they oftentimes, even if they are using graded exposure and they start off with easy things and gradually work your way to harder things, they tend to be so laser focused on corrective exercises. So they give you, let's say they give you graded exposure, but they start you with, core stability exercise. So let's say you're doing belly breathing. Okay. And then the next step is you're going to do core stability, like intra-abdominal pressure breathing. Okay, cool. Next step, you're going to do heel taps. Next step, you're going to do dead bugs. Next step, you're going to do like planks. And next step, you're going to do farmer's carry or something like that. Okay, cool. That was a progression. So we didn't do too easy or too hard. We didn't go too fast or too slow. But we were too narrowly focused. So really, this should be its own reason. Let's say reason number 6. But if you're too narrowly focused on only one little aspect of full body fitness, right? So full body fitness is cardio, strength, mobility, endurance, stamina, motor control, balance, right? We've got all these things. And then we can apply any of those concepts to all of our major joints and all of our major muscle groups in every direction of movement. Move fast, move slow, move heavy, move light, move forward, move backwards, move up, move down, right? Jump and land and get up and down and off the floor. So we got to move all of our body, right? We can't just say, oh, let's use graded exposure, but we're only going to do it for hip mobility, or only we're going to do it for core stability. That's stupid. That's just really, really, really stupid, especially for people that have, it's weird. It's a weird thing because a lot of people get into physical therapy or become chiropractors with a previous exercise science background and personal training. And this is just basic stuff that we all know. But when we learn a bunch of fancy stuff in our doctorate degrees, we get so in our heads and up our rear ends about the knowledge that we have, that we think that we overvalue the minutia. We get so far in the weeds that we overvalue our own, it's like a sunk cost fallacy. It's like we go to school, we spend all these hours and tons of money and time and blood, sweat, and tears learning all these things in school. And so we overvalue them. When the real truth is that most of those things are out of date. They're not evidence-based. And it's just one small part of a very complex system. So core stability is fine. You need some core stability, especially if you're going to like deadlift and squat, which by the way, are perfectly safe for back pain and sciatica if you work up to them slowly in a comprehensive way. But we also need hip mobility, knee mobility, quad strength, hamstring strength, glute strength, back strength. We need all the muscles to work, right? And like with a deadlift, you also need your upper body involved in that activity. So we can't just boil down, even if we have back pain, and even if we accept the premise that the back pain is largely due to sensitivity or damage to actual tissues in the back, which I do not accept that premise because it's widely debunked. We know that pain is more systemic, especially chronic pain, that it's more multifactorial. So we cannot boil pain down to a single structural abnormality, such as a disc herniation or just the piriformis muscle or something like that. But even if we accepted that premise, we would still have to realize that doing exercise just for one muscle, like your piriformis muscle, even if the only reason that a person had pain was because their piriformis muscle was torn, okay, we would still have to use full body exercise to make that area resilient. Because, well, great, we can do all the piriformis stretches in the world and target that one muscle, but eventually you're going to have to squat and hinge and lunge and bend and picking things up off of the ground and get up and down off of the ground. And like, you're going to have to do activities that are outside of the scope of just stretching your piriformis muscle. So again, even if we accepted the premise that a single muscle could be blamed for your chronic pain, which we know for a fact is not true based on current scientific evidence and modern pain science literature, we would still have to zoom out and look at full body exercise, strength, and physical fitness, right? So zooming in with cookie cutter exercises and not using graded exposure, obviously that's going to lead to, too much, too little, one or the other. Usually it's too little. Usually your PTs baby you because they're so focused on alignment and core stability stuff. But beyond that, we need to not be hyper fixated on one little area of the body, and we need to strengthen the full body instead. And then the next reason, so that was kind of a rant, but I think it's really important. So I think technically we're actually on reason number 3 now. Okay. So reason number 1 was cookie cutter stuff. Reason number 2 is you do too much too fast or too little for too long. It's not personalized, and you get hyper focused on little areas of the body instead of looking at a comprehensive system. Number 3 is no support system between sessions. So, okay, let's say you have a great session. A lot of people, we work remotely with our clients. So we work remotely. We have clients we've had clients in so many countries: Italy, Ireland, Netherlands, Japan, Australia, the UK, Canada, the United States, Spain. We've worked with people all over the world, which is a really, really cool thing. And we get, honestly, better results than when I used to do in-person clinical practice. That said, we still get people who, when I talk to them about our programs, they're like, well, I'm interested. I'm kind of curious. But I would like hands-on treatment. I want to just have somebody in person. And I say, okay, cool. What's going to happen in between sessions, right? How much can you get done in a session? Well, they can evaluate you. Okay, that's cool. They can watch you do exercises. Okay, that's cool. They can do hands-on treatment. That's fine. Short-term pain relief, but it's still fine. And they can tell you what exercises to do when you go home. Okay, cool. But what actually gets you better? Is it the session, or is it what you learned in the session? Right? So what actually gets you better? Is it the time that you spend in the session, or is it the time that you spend on your own doing things that matter, like doing your exercises? And I think most people would agree, well, obviously the reason we get better is because of doing the exercises at home. Okay, cool. And not just the exercises, it's also lifestyle change, which PT doesn't address. And we'll get to that in just a second. But they give you the exercises. Let's say they evaluate. Okay, cool. Like you get it. I feel perfect. I do these exercises. I feel great in the clinic. Awesome. I feel like $1 million. Go home. And I try the exercises, but it feels weird. Now it's kind of feels, like it's flaring up a little bit. What are you going to do? Well, you're either going to keep pushing through it because you assume that it's the right thing to do. That's what your PT told you to do, and you're a good patient, so you're going to keep doing your exercises. But now you're pushing through something that you shouldn't push through because you went home and it doesn't feel the same way that it did in the office, and you're not sure if you should keep doing it or not keep doing it. So if you push through it, then you're just pissing it off for a week until you can go back and have another session. Or you say, no, this doesn't feel right, and you skip it and you stop doing your exercises. Well, now you have a whole week of wasted time where you haven't done your exercises at all because you didn't know how to modify. So PT in the traditional model has no support system between sessions. And what about not just support with telling you, hey, like here's how to modify your exercises, or if you have a bad day, helping you guide you through it and modify and offer alternative exercises, which is what we do in our programs, because you can message us anytime and we can guide you around how to modify things and you can get a quick response. But with the traditional model, it's not just that, but it's, What if you have an emotionally bad day? What if you have a stressful day? It's not even about the exercises. It's just you're down, man. Like chronic pain sucks. So what if you're just demotivated, depressed, anxious, fearful? How are you going to deal with that? And then then it comes back to the same problems, which is you either are pushing through things you shouldn't, or you're skipping things, or you're wasting your time, or there's no guidance. Like maybe it's not about getting you back on track with exercises. Maybe it's that we needed to get you on track with some stress relief activities instead. So not having a support system outside of clinic time is a big deal, because the magic doesn't happen in the session. The magic happens with lifestyle change. And ultimately that comes down to you doing it. But if you don't know what to do, or you're pushing through things you shouldn't, or avoiding things, or you're scared, or you're depressed, or you're anxious, how are we going to deal with that? And PT just can't address that in the typical model. And again, the typical model is based on what insurance will reimburse for, right? Because insurance doesn't pay for chat support, or, being able to just call up and ask questions anytime. Insurance doesn't pay for exercise program design and accountability and structure and support in that way. And so I'm not saying that physical therapists are bad. The system is set up in a way that is not supportive. Okay, so the next reason number 4, why PT often doesn't work. They're using fear-based, outdated, widely debunked methodologies. These are not evidence-based. There's a heavy focus on core stability, on fixing your alignment, your posture, your pelvic tilt, your leg length inequality, your tight psoas, your weak gluteal amnesia, your glutes are asleep. That's not a real thing. None of the things that I just named matter at all. We have tons of videos where we debunk this and we look at all the literature on this, but this is widely debunked. We have tons of literature showing us that alignment and core stability and pelvic tilt and leg length and all these things are either very weakly associated with pain or not associated with pain at all, not correlated. So we cannot blame pain on asymmetries, because every single human being has asymmetries. In fact, with core stability, sometimes we see that people with back pain have stronger cores. Yeah, I can't tell you how many people I've talked to and worked with in our program that they said, I don't think it's my core stability. My core, if anything, is really, really strong. It's stronger than it's ever been. And I still have chronic back pain. And in those cases, we actually have to take the opposite approach. And we have to teach people how to relax their core, because they're so stiff and overprotective, right? And this is the fear-based dogma. It's not okay to bend your spine. Don't bend your spine. It's bad for the discs and a disc herniation. It's going to make your sciatica worse. Well, what does that lead to? Fear. Then you stop moving your spine, you get deconditioned, and then when you do go to bend, it's a self-fulfilling prophecy, because you haven't bent your spine in so long that when you do bend it, it's so out of the ordinary and your body is so deconditioned and not used to it that of course you're going to have pain doing it, not just because of the deconditioning, but also because of the fear-based response of when your body does catch yourself doing the thing that you're afraid of doing, your muscles are going to brace for dear life because they never do it, so that when you do bend, your muscles say, whoa, hold up, we can't do that. We don't like that. And so they hold on for dear life, and then we get muscle spasms and flare-ups. But it's not because bending is bad. It's because you haven't done any bending that it's a self-fulfilling prophecy that you do have pain when you bend, but it's because you don't bend that you have pain when you do bend. Okay? I know that was a lot of words there, but the point is, bending is safe. Bending is good. A good, healthy spine should be able to move in every direction, but we don't just throw you to the wolves and have you do Jefferson curls. We ease our way in systematically and work on full body strength, resilience, mobility, motor control, balance, starting from the ground, working our way up using graded exposure. Then the next reason why a lot of PT doesn't work is because it doesn't address lifestyle factors like stress, anxiety, depression, sleep, nutrition, fear, people, places, things. Your lifestyle impacts pain just as much or more than disc herniations and degeneration and nerve root impingement and all those types of things. So if you're not getting guidance on stress, which we know that stress is a much bigger predictor of pain than disc herniations or degeneration. I want to repeat that. Stress, anxiety, and depression and fear are a much better predictor of chronic pain than most of the stuff that you would see on your MRI. And yet most people are freaked out about their MRI, their disc herniation or their bulge or their degeneration or stenosis or scoliosis or spondylolisthesis. They're so worried about those things, but then they're not addressing stress, sleep, nutrition, depression, fear, which again, especially the depression, fear, and stress are much better predictors of pain than the stuff on your MRI. So we have our priorities completely wrong. I'm not saying that the structure doesn't matter. I'm saying that other things like graded exposure to full body fitness and mental health and recovery through nutrition and sleep matter much more. So we have our priorities in the wrong order. Okay. Again, want to be totally clear. Pain is not in your head. Pain is not just in the brain. We need a full human being approach that addresses stress and mental health as well as physical fitness. It has to be both. And that's, by the way, the other reason why some PT doesn't work, because some PTs have gone so, I guess now I've added a lot of reasons beyond my 5 reasons, but this would be another reason, is that some PTs have gone so far down a pain science rabbit hole, like John Sarno and Alan Gordon, that all they focus on is the mental aspect of pain. They just convince you that it's 100% in your head, and all you got to do is just go out in there and run a 5K and just prove to yourself that you're not damaged. But then people get flared up because they haven't run at all in years and they're deconditioned. So just because you're not damaged doesn't mean that you have earned the right to do difficult exercise. You still have to respect strength and conditioning principles and work your way up to build that physical strength and resilience to earn the right to do those hard exercises. So that's, we can't just do the mental game. We have to do both. Okay. So just quick recap. Reasons why PT doesn't work. Cookie cutter exercises, you're getting the same thing everybody else is doing. Too hard or too easy. You're not using actual graded exposure. You're either skipping steps or you're getting babied. No support system. Oh, and then the little middle option there, or middle reason, is because we're so focused, so hyper fixated on one little area of the body that we miss full body physical fitness. And then no support system between sessions. Then reason number 4 or 5 at this point is fear-based, outdated, widely debunked methodologies. And then beyond that, our last reason is that we are not addressing lifestyle factors like stress, sleep, and nutrition. So what do we do instead? Well, instead, we need safe pain protocols. We need to understand the difference between safe pain and unsafe pain, because if you push through unsafe pain, you're going to flare it up. And if you never push through anything and you baby yourself, you're never going to get stronger. So many people, we need to fix your relationship with pain, because anytime you have any pain, it's like the worst thing in the world to you. But the truth is that some pain is 100% safe and normal, and we need to understand that so that we can stop freaking out every time we have any amount of pain. Okay. So we got to find that Goldilocks zone. We have to know the difference between safe pain and unsafe pain. And by the way, that means safe symptoms and unsafe symptoms, because numbness, tingling, electrical, burning, itching, whatever, those things are also could be safe, could be not safe. It kind of depends. Number 2, what do we do instead? Use graded exposure, gradually increase difficulty over time to full body functional strength and mobility. Okay. Should I stretch or should I strengthen? Both. A functional body needs to have mobility and strength. And it has to apply to every joint and every major muscle group in every direction. So, safe pain protocols, graded exposure to full body fitness. Next, we need pain neuroscience education so that we can dismantle false fear-based beliefs. The more that you understand about pain neuroscience and current modern research on chronic pain, the more that we understand we don't need to be afraid about our posture, our disc herniations, the things on the MRI, our leg length, our pelvic tilt, our alignment. Those things do not matter nearly as much as you've been told that they do. It's not that they don't matter at all, but compared to graded exposure, understanding the difference between safe pain and unsafe pain, and looking at your life holistically, that's mental health, stress, nutrition, sleep, exercise, the full picture, those things matter way, way more. So stop worrying about your alignment and stop worrying about the things on your MRI as long as your doctor has ruled out red flags. And then the last thing that we need to do instead of typical physical therapy is take a biopsychosocial approach, which means we address the whole human being. I like to think of it, I call it the 4 pillars. That's exercise, nutrition, mental health, and sleep, in no particular order. Typically, with our clients in the Beyond Back Pain program, we see that exercise is always a must. Everybody needs guidance on exercise and gradually building up strength and resilience. And most people, number 2, would be stress and fear and depression. Most people need ways of getting their nervous system out of an alarm state, because even if you don't feel like you're a stressed out person, just being in pain in and of itself is a stressful experience. And we need to turn that alarm system off, because your stress system and your pain system are very directly linked neurologically. It's not in your head. These are real things that we need to not be freaking out about our pain and becoming overprotective and tight and muscle spasms. And by the way, stress, it leads to more inflammation. And I know inflammation is a buzzword, but I literally mean inflammatory cytokines and neuroimmune responses and things like that, and changes in neurotransmitter activity, things that just heighten the pain response. Okay, so there's a lot to that, but the point is, most people, let's quickly summarize what we've learned today. Most people that don't have success with physical therapy, if you're dealing with chronic back pain or sciatica, or really any kind of chronic pain, it doesn't work for those people because they're taking a cookie cutter approach, they're skipping steps, or they're babying themselves. So that's our too much too fast after too little for too long. All right, our rule of 2s. They're hyper-focused on little specific things instead of taking a full body approach and using graded exposure. There's no support system between sessions, nobody to reach out to and ask questions. They're being given fear-based, outdated, widely debunked methodologies. And they're not addressing lifestyle factors like stress, anxiety, fear, depression, sleep, and nutrition. And if we address those things, if we give you our safe pain protocols, if we teach you a graded exposure to full body physical fitness, if we teach you the neuroscience of pain so it's less scary, and if we take a 4 pillars or holistic whole person approach and address lifestyle factors and put you in control of taking care of yourself and hold you accountable to doing that, you can reclaim the active life you deserve to be living. So if you want to know more about how to apply these principles, we recently released a brand new masterclass. Our masterclass now is more practical than it's ever been. We summarize our safe pain protocols. We talk about how to use graded exposure. It's not just a giant hype fest. I know a lot of people with these free trainings, people are, like, oh, it's just, motivational, but there's no substance. There's no solutions. Our new masterclass is nothing but solutions. There's a lot of myth busting in there too, but every time I myth bust something, I also tell you exactly what we would do instead, and I give specific examples and case studies. So if you want the most practical training you've ever had in your life, we put together a free training, a free masterclass. Click the link in the description. Watch that masterclass. And then if you're interested in working with us, you'll have an opportunity that you can apply to work with us. But even if you don't, you're going to learn more in this free paid training than you would from paying for, weeks and weeks of physical therapy. I promise you. So click the link, watch the masterclass, and I look forward to teaching you more and helping you reclaim the active life that you deserve to live. And I will see you in the next episode.